We'll focus on pulmonary thromboembolism. This is a major cause of death and post-operative care, etc. As a ratio being given 20 to 25 out of 1 lakh of hospital patients. Sorry, 95% coming from deep vein thrombosis, that too above the knee. The veins above the major veins above the knee, there are more chances of pulmonary embolism arising of a pulmonary embolism. Usually it is a small. If it is small, a small pulmonary thromboembolism, it will be silent, no much symptoms. I'll explain it later. And medium, there is a pulmonary infarct with acute respiratory and cardiac symptoms. If the size is medium, there is cardiac and respiratory symptoms. If it is large, there is a right heart failure. The pulmonary thromboembolism is large, it leads to the failure of the right heart. And massive, again, it's also the failure of the right heart. Leading to death. May occlude the main pulmonary artery. Saddle embolus, it's called as a saddle embolus. It's a large or massive embolus occluding the main pulmonary artery. It causes sudden death. Or it can occur in small branches of vessels in multiple forms, multiple emboli. So this is for your idea of traveling of the pulmonary embolism through the lower veins from the veins above the knee, and it's coming up and reaching the inferior vena cava and the right heart, and from there it is transferred to the pulmonary artery to the lungs. So these are the area in the pulmonary artery where there is chances of pulmonary thromboembolism. So it's clear from this picture. So 60 to 80% of all these pulmonary thromboembolism these are asymptomatic, and it produces symptom only if the size increases. Usually these kind of embolisms, it organizes. I have mentioned in the fate of emboli, it's organization. So usually pulmonary thromboembolism undergoes organization, and it leads to formation of a scar. Then it can lead to cor pulmonale, the condition called as cor pulmonale, or the right heart failure, where the right ventricle fails to work. It can lead to injury symptoms like edema, um, chest pain, or cyanosis, or fainting. Uh, then other symptoms of lung disorders such as wheezing, coughing, etc. So all these conditions can be formed, and also sometimes sudden death can also result. Usually these result in hemorrhages and rarely infection. Hemorrhage can be formed. And obstruction of small vessels leads to small infarctions in many areas, and multiple emboli, it leads to pulmonary hypertension. The effects of pulmonary embolism I'm continuing. That is a massive pulmonary embolism. It's a more than 60% reduction of blood flow. It is rapidly fatal. So if the blood flow is blocked by more than 60%, it's fatal. Then major pulmonary embolism, there is a medium-sized vessels are blocked. There is shortness of breath, and cough and blood-stained sputum that is present as symptoms. In minor pulmonary embolism, there is small peripheral pulmonary arteries that are blocked. There is asymptomatic, or there may be minor shortness of breath. And as I told, recurrent minor pulmonary embolisms, such short embolisms, it can lead to pulmonary hypertension in a course of time. Now we'll come to systemic or arterial thromboembolism. So arterial thromboembolism, these arise in usually the arterial system, that is the heart and large arteries. The major causes in arteries explained before, atheromatous plaques and aortic aneurysms, and in the heart it is the mural thrombi in the left atrial or left ventricular walls. Then valve vegetation, that means any kind of bacterial growths that can produce injury and formation of an thrombus and later embolize. Then prosthetic valves, that is artificial valves following surgery, it can induce an emboli. Then cardiomyopathy, where the heart muscles are not functioning properly, again it can produce an thrombus and an emboli. The effect of this depends on usually the size and site of lodgement and adequate of collateral circulation. If the site of lodge is smaller, it can cause complete occlusion. And if collaterals are present, the effect of the embolism can be reduced. Continuing with the effects, this arterial thromboembolism travels in the systemic circulation and causes arterial occlusion, distal ischemia. That means loss of blood supply distally. In infection, can cause infection, gangrene, the death of the tissues. Then arteritis, inflammation of the vessels, myocardial infarction, and sudden death. So if it is in the brain, it can produce stroke and many neurological deficits, neurological symptoms, and or death. Renal and splenic infects, it may be asymptomatic. Later in autopsy, it can be seen as ischemic scars, or small areas where there was lack of blood supply. Then intestines, the mesenteric emboli, it can cause intestinal infection. It can be lethal. And the limbs, ischemic foot or dry gangrene. The foot gets gangrenous due to lack of blood supply. So we'll continue with other type of embolism, that is the fat embolism. It's obstruction of arterioles and capillaries by fat globules. An example of a liquid embolism also. The cause is trauma to the bones and soft tissue. For example, if there is a fracture of the long bone, the fatty marrow is entered into a circulation and it can embolize. After an ortho surgery, it is possible. Then non-traumatic reasons are burns, which can release fat. Then fatty liver, accumulation of fat in the liver, it can slowly enter into circulation. So all these are reasons for fat embolism, and the effects are pulmonary fat embolism, leading from a fracture. This is always it's a common complication in a fracture, let's say, of the hip or the long bones. An embolism can enter the circulation and reaches the lungs, producing pulmonary embolism. That is usually pulmonary fat embolism. Then systemic fat embolism can occur due to septal defects. There is a paradoxical mix of the arterial and venous blood and can produce a systemic change into a systemic fat embolism. Then gas embolism, usually by air, nitrogen, etc. Then two main forms of gas embolism, that is air embolism and decompression sickness. Air embolism is venous and arterial. Venous, it is following trauma or surgery on head and neck or injection of IV fluids while doing so. By all these methods, air can enter, or angiography you are doing. So air can enter into the circulation. That is venous air embolism. Then arterial air embolism, you following cardiothoracic surgery and trauma, etc. On paradoxical, that is change septal defect due to septal defects, venous to arterial. Then arteriography, by all these procedures, air can enter into the arterial circulation. So it is the air embolism in gas embolism. And just to give a basic idea of the decompression sickness, is also a type of gas embolism. When a person decompresses suddenly from a higher atmospheric pressure to a normal level, or from a normal pressure to a lower pressure level, and when they come back to the normal, the chances of decompression sickness are present. Is usually seen in divers. Divers means deep sea divers, offshore drilling and tunnels, then high altitude hikers. So there is a difference of atmospheric pressure. The descent to a high atmospheric pressure area. So in case of divers, there is an increase of amount of the atmospheric gases, oxygen, carbon dioxide, and nitrogen dissolved in the blood and tissue fluid. And when the person gives a rapid ascent to the normal level, it can make all these gases to come out of the solution as minute bubbles. And these bubbles join together to form a large emboli which is carried through the vein. So these are the reason for decompression sickness.